It's Dr. Bernice, and we are here for Teaching Thursdays with Dr. Bernice, a brand new series. And I'm so excited to go through a bunch of learning topics, just really breaking down a lot of medical mysteries, misconceptions, confusions. It's targeted to three really big, important populations that I interact with regularly. The first one is patients. I've noticed that when I have conversations with patients, they're so confused about things that I think sometimes healthcare professionals just assume that everyone knows. Literally, just during my shift, I had somebody who had been diagnosed with gallstones. And before I was going to discharge him, mind you, he had already seen three medical professionals about this issue. I said, "Do you know what gallstones are?" And he was like, "Actually, no." And I was like, it's funny that nobody's taken the time to really just break down exactly what that means. And every time I have interactions like that, it gets me thinking, how many more of these types of issues are there where we're speaking at people, not with them, and they're not an active participant in their care? So I really wanted this series to target that population as one. The other thing I realize is that medicine, being an ER physician myself, a lot of my job is communication. If I'm not communicating to patients, then I'm communicating to the nurses, medical assistants, pharmacists, consultants, so many other people that I work with. And there are so many ways that there can be pitfalls with communication, and a lot of powerful ways that when communication is done well, it can completely transform an entire clinical experience. So the other population that my teaching will focus on are fellow medical professionals. Some of the videos will talk about just ways to succeed as a medical professional who's trying to communicate with the people around them. And then the third, and definitely last but not least, population that these videos will be targeting is my medical trainees. I know that the path to medicine can be really, really tough. I've been a pre-medical student, medical student, and I took some little deviations in between before becoming a medical resident, and now an attending physician and an EMS medical director. So my pathway has definitely not been linear, but I've learned so many lessons along the way. And so I am talking to my medical trainees on different topics every week. Sometimes it's going to be just kind of bread and butter, medicine. Let me answer your questions. Let's get down to the nitty gritty. And sometimes we're going to go into the how can we be better doctors? And sometimes we're going to be talking about how do we even get to this point? I hope all of it will be fruitful for those of you who tune in, and I hope that I'm able to touch a lot of you guys and hopefully just help inspire you, help you understand your body, your situation, your life a little bit better. That would just give me so much fulfillment. You guys have no idea. So thank you for tuning in. Thank you for being engaged. Thank you for the OG being Dr. Bernice subscribers. And I hope that this community grows as we move forward. And again, sorry for the wait. I will see you guys on this series.